hospitals in Ontario to the brink. And that is why a new hospital in Vaughan, just north of Toronto, is changing course. It will now focus on easing capacity concerns linked to COVID-19. Let's get more on this story now from CTV's Mike Walker.
When the new Cortellucci Hospital in Vaughan opens its doors next month, it will solely be dedicated to accepting patients from other GTA hospitals facing capacity issues caused by the pandemic.
We said maybe we should be doing something differently and finding a way to add more capacity.
Patients from overcrowded hospitals will be transferred here starting on February 7th. This comes after the province requested Mackenzie Health to temporarily change how the brand new hospital will operate.
This hospital will take in critical care patients from surrounding hospitals to help ease capacity pressures around COVID-19.
To start, 150 medical beds and 35 critical care beds will be available. The GTA Hospital Incident Management System, which oversees bed capacity, will decide which patients will be transferred here.
Over the last number of weeks and months, the exclusive type of patient has actually been COVID-positive patients. So we will have a mixture of COVID and non-COVID units in this hospital.
During this time, the hospital's emergency department will not be open. The plan is welcome news for healthcare workers on the front line.
It helps take the pressure off of the existing acute care facilities that are looking after patients with other needs.
The province is reporting 1,571 COVID-19 patients are currently hospitalized, including 394 in the ICU and more than 300 on ventilators. The province also announcing it will spend $125 million to create 500 additional hospital beds in the areas with the highest rates of COVID-19.
We're working with Ontario Health to select these hospitals with the primary criteria focused on their physical capacity to add beds and the availability of healthcare workers to staff them.
But some experts say the biggest challenge will be staffing.
They're not infinite in number. So where are these people going to come from?
A challenge Mackenzie Health CEO acknowledges. He says the health network plans to recruit more staff and add more beds as capacity ramps up.
Our plan calls for an additional 24 beds in the emerge department if it's needed.
And for more on this, I'm very pleased to be joined by the Mayor of Vaughan, Maurizio Bevilacqua. Good to see you, Mayor.
Good evening.
Your thoughts on this new hospital? Always a momentous occasion, I would think, to open up a new hospital. How often does that happen? But especially now, right?
Well, this is the very first hospital here in the city of Vaughan. We've been waiting for generations upon generations of Vaughan residents have been waiting for this hospital to open. It's a $1.8 billion hospital, first smart technology hospital in the entire country. And really, today's announcement is proof positive that the Canadian compassionate, loving, and nurturing spirit exists in the city of Vaughan. We know that the province, the capacity is really under stress, and we felt that it was a wise move to be there for people, not only for the city of Vaughan, but throughout the GTA. We know the seriousness of COVID-19. We take it very seriously, and I wanted to make sure that we have the type of flexibility, and the province wanted this type of flexibility to really get through this very, very difficult period.
Yeah, we're looking at visuals of what seems to be a state-of-the-art facility. We just heard from Dr. Sharkawi, who is frequently on CTV News Channel to give us some color with respect to COVID-19 and the latest on the cases. He just alluded to the fact that, yes, you will have staff ready to treat patients outside of York Region, but he said staff is not infinite. We do have to take many precautions to make sure that whether it's your hospital or any hospital, they're not overwhelmed, right?
I think COVID-19 has taught us a great deal about healthcare capacity in general. You know, we're focusing on COVID-19, but perhaps Canadians would probably have the expectation that not only do hospitals should focus on COVID-19, but also other facets of healthcare. This is obviously a dialogue that has to take place after we get through, obviously, COVID-19. But there's no question about the fact that we have to redesign the healthcare system because this global pandemic may not be the last one. And, you know, global pandemics, we were talking about it 30 years ago, and it's obvious to everyone that perhaps we didn't spend enough time during this period to get ready for it. But now that it's here, we are learning lessons. One thing, for example, that we've learned quite obviously is that we've underestimated the strength of COVID-19, and perhaps we overestimated the capacity of Canada's healthcare system to go through these difficult and challenging times.
Yeah, you know, and many of your colleagues would say it's an unprecedented time. Here you are celebrating. Well, one would say you'd like to celebrate the opening of a hospital, but boy, oh boy, is there a lot on your plate right now, a lot of stress for your healthcare workers, frontline workers, as one would think you will have to answer the call and help your neighbors, presumably to the south of you.
But the purpose of life is to to really add value to people and to improve the human condition. And I think we're very fortunate in the city of Vaughan that we've been called upon to help neighboring municipalities and cities in the province of Ontario. And we do that with an open heart, and we do it by sharing our resources.
All right. Good luck with that, Mayor.
Thank you so much.